Welcome to my podcast, The Laura Dowling Experience. Many of you will know me from my Instagram page at Fabulous Pharmacist, where I love to shine a light on topics that people normally shy away from. Today I spoke with Dr. Bronagh Keane, otherwise known as Ireland's Tooth Fairy. Bronagh is a dentist and we discussed all things dentistry. We discussed why dental treatment in Ireland is so expensive compared to other countries, why a lot of dentists in Ireland are opting out of medical card care. We spoke about the pros and cons of dental tourism and smile makeovers, and we also discussed how to look after your teeth on a day-to-day basis. I learned loads from this podcast, and I know you guys will too. To support the Laura Dowling Experience, please check out my sponsors in the podcast notes below. Enjoy the show. Bronagh, thanks for joining me today. You do have the whitest teeth I've ever seen.
Thanks. I'm my own marketing, so I'd hope so, Laura.
Absolutely. I'm here today with Bronagh, who is a dentist, and we have so many questions in. So I'm going to start with just tell me a little bit about yourself.
So as you already mentioned, I'm a dentist working in Dublin. My main thing is cosmetic dentistry, so hence the white teeth, but absolutely love general dentistry. And love getting like everyone involved, which is kind of, as I was previously mentioning, that I have got like more involved in social media, kind of like yourself, to like break down the topic and get people more involved in their health, and just like excited about the dentist because it's one of these things where everyone just hates the dentist.
Yeah, there's a huge phobia around going to the dentist, and a lot of people did message in saying, how do we avoid the dentist phobia?
Yeah, like that is definitely a big one, but I do feel like it all comes down to building a relationship. And like in college, I was like, oh my God, I'm going to be a peds dentist. And my dad was like, give it 5 seconds.
Is your dad a dentist?
My dad's a dentist.
Okay.
And like, I think because of my love for that in the undergrad part, I definitely managed with the anxious patients and all of that. But in the end, you're treating like 3 patients. So it was very difficult. Kind of specialty, but the anxious thing really just comes down to definitely building a relationship with the dentist, making sure that you're not feeling rushed, making sure you're on time for your appointments.
Yeah.
Not like me today.
Bronagh was a little bit late for the podcast today. She got lost, but it's okay because I phoned her prior to meeting because I was also late, and I don't like people waiting outside the studio for me. So I was like, I'm sorry, I'm late. I stuck my mascara wand into my eye, and this is me because I was rushing up to you because I was cooking dinner for the kids before I came up. What time is it? It's 12. It's 12. So I was cooking dinner, rushed up to my mascara and stuck my mascara wand into my eye. So I'd like, you know, my tears were streaming. So my mascara was streaming down my face. I was like, oh my God, I have to be up there in 10 minutes. But anyway, we made it. So be at the dentist on time is a good thing to kind of relax into the appointment. Yeah,
trying to get relaxed. Like everybody's going to be able to offer you a glass of water. I always find that's really important. Like being able to just
You're going to say a glass of wine. I'd love that. That's a real way of relaxing.
Kind of interferes with the consent thing, so we have to like stick with the water. So just getting your glass of water. Like often that, like a lot of the time, again, like the scale and polish is combined with the consult, but if you actually go for a consult on its own, you're going to just have that like very like fearless appointment, in the sense that all you have to do is, and I know for a lot of people that's a big thing, but it's just, you just have to get into the chair. And even getting into the chair is a huge step for people, and without even thinking about treatments and stuff. So when people reach out to me for appointments and they're telling me how nervous they are or whatever, I will always tell them, don't even think about the treatment. Let's not do anything. And I agree with that before they even come in, because I think a lot of the time, this seems to happen more than I would like to think, but people get surprise attacked with treatments, and it's like, oh, you're here now, let's do that. And like, that's definitely not the way to go. And people definitely shouldn't like feel under pressure because it's being suggested. Just reschedule to another day for the clean or for those fillings that have come up or whatever. Like never do anything under pressure, because like that's just not going to help you, and you're not going to fully understand what's happening. And like, you definitely, like a consult should be just really getting through all the questions, really understanding what's going on, and not be thinking about like, when she kind of poke me or whatever. And like, that's another thing again in the exam and stuff. Some people prefer to know everything that's happening. Some people prefer to know nothing. So if you want to prefer to know, most people actually do it, like ask them. And then like, I'll literally be like, okay, I'm going to do this now. I'm going to do that now. And at least when you know what's happening, I think like a lot of the time it's because you don't know what's happening. And like even when I'm getting my hair done in the hairdressers, I'm like examining what's happening, and you can't do that in the dentist. And I think that's a real fear causing pain.
It's also a very intimate
Very
thing.
intimate.
You're literally, someone is there with their mouth open and you could do anything to them. It's really intimate. And it's
very
so,
vulnerable
they're in a vulnerable position, so I can understand. Do you ever prescribe Valium to people?
I've only actually done it twice now in my 4 years. I really, and I don't do it because I'm like an anti-prescriber. I will absolutely do it if someone needs to, but I will always try to really not get them to do it. Just in the sense, I really love when people can just eventually skip into the dentist.
Okay.
And I think that's a lot of part of like my approach to it, and like loads of people that will have come to me will have come in for that initial consult exam, really not even wanted to clean, and they will be skipping by the end of it. And I think it is just breaking that down, making it more friendly and approachable. Like I work with Sarah as well, and like she is very good at relaxing people. I think, again, a good team environment, like the girls at the Desmara, everyone's so good at like keeping everyone like relaxed and stuff like that. And I think if you're getting standoffish people, you're going to be standoffish, as a patient. So I think like that's just really important to like feel relaxed and stuff. And I always feel like people can just get through the appointments with it. It just takes more time on the dentist's behalf, which is where I guess
sometimes jarring for some
lies, because time is money.
Yeah.
So, I mean, that's like the fact of the
Moving
matter.
swiftly on to money now that you've mentioned it, Bronagh. It's actually interesting that you brought this up yourself, because it was my next question. Why is dental treatment so expensive in Ireland? You have people going to Turkey and they're spending 3.5 grand on something that would cost 20 grand over here. Please discuss.
Okay, so I actually put on, the way we have all our hats.
Yes.
I put on my detective hat, and I actually decided, now I'll get into the costs of everything myself, but I actually decided that I was going to look into getting treatment abroad for myself. So dental tourism is anyone that goes abroad for dental treatment with a cheap price. So when I say, what I am not saying is that all dentists in Turkey or Spain or wherever are bad. That is absolutely not what the phrase dental tourism is coining. What it's coining is when you get like your holiday involved, and your city break afterwards, really cheap treatment, done quickly. The majority of the time, the dentist in Turkey or Spain or wherever is going to be the same price in Ireland if it's to the same standard of treatment. So when people... I'm actually diverting completely over, but so I'm going to just come back and say that why. So what I decided to do was I decided to look into getting the dental treatment myself. And they had suggested for me that it was going to be 20 veneers.
Okay.
On my teeth. Now, I'm not...
Did you just do this as a detective work? You were
purely by myself, because I was so curious. I get a lot of people saying that their friends are thinking of going abroad. They come into me, they're like, should I do it? And I'm like, absolutely not. And it's really hard to like pitch that idea of not doing it without seeming like a salesperson. Mm-hmm. But like as a dentist, your primary role is like a health professional, and to obviously abide by ethics and standards to that degree. And I think a lot of people do forget that. I do think that there has been a lot of stories and a lot of stuff has happened to lend to that. But the answer definitely isn't to go abroad and get cheaper treatment. Like I was being suggested then the 20 veneers for 6,500. If at max one of my teeth is crooked, which my dad always tells me about, and at max it would be to straighten them, and it would be like in and around 3,000, and that would be it. I would have no long-term complications. I wouldn't have to get the treatment done again in what did they say it would last 10 years? Wouldn't have to get it done again in 10 years. And they would be my own natural teeth, and they would be untouched. And then the other people are then saying, so then I'm getting told, oh, I need 20 veneers. If I was to get 20 veneers here, yes, it is going to be like, what is it? Quick maths, I should have worked that out before. But it's definitely going to be like up at 30 grand. But I've never, ever, ever told someone that they need 20 veneers.
What is a veneer?
So a veneer covers the front surface of the tooth, and a crown then, just to kind of leave like a difference, covers the entire surface of the tooth. So a crown will cut down like all the surfaces of the teeth, compared to veneer will just take the front 0.5 millimeter off the tooth. So it's very like technique sensitive to do it. So it does take a lot of time to do. And that's why when people go abroad, you're getting these shark teeth. And why you're getting them is because they're cut down so much. And they're getting cut down so much because it's too time consuming to do the veneers to a fine like standard because they're so fine and finicky and they just take that much longer. So what they will always say, or what I believe they will say, is that the crowns are stronger for your teeth. But if you have perfect teeth, the crowns aren't stronger because you've just removed so much tooth structure and you've actually weakened the tooth.
Okay, so are veneers and crowns purely for cosmetic reasons then?
So veneers are purely cosmetic, and then when you choose,
like, they're very white. They look almost fake sometimes.
Yes, and there's so many good questions here, but I
think this could be a podcast on only veneers only. If we go down that route, we're going to be here all day, but we're not. We're going to try.
I'll just finish on the crown thing there for a second. The crowns are like if you have big fillings, if you have root canals, if you have stuff like that. Because I don't want people being scared to get crowns either. Like that's not it. Like there is a time and a place for them, but they're always way more justified compared to veneers are purely cosmetic. Like, purely.
But why would you only get one veneer if you've like? Would your teeth not? Or would it not stick out like a sore thumb? As in you'd have one big shiny tooth and then the rest are coffee stained.
So that would be like if you had like a trauma tooth when you were younger and it never died off, but it discolored yellow.
Okay.
Or if you had like that's pretty much like it's something like that where the tooth structurally is still intact.
Okay.
But it's just like a discoloration thing. And you're just trying to, again, you're always trying to preserve the tooth structure. Now about that looking fake and stuff, it's not really ever going to look fake first if you go to the right person. And that's why when, like, again, you're talking about those costs abroad versus here. Like a lot of people forget that a dentist is actually using a ceramicist as well for crowns and veneers. So that's another person working with you.
Is using a what for?
A ceramicist. So we're not making them, like most places won't make them in-house.
Okay.
So they're like lab made. So you have to send them out and it's a person with another qualification who's very highly skilled, spends loads of time making them. And like they will do all these layers and add all these colours to make it look natural. Okay. And they'll put so much time and work into it. When you're getting those fake teeth.
Turkey teeth. That's the name of them.
That's what
people are asking. Did you say turkey teeth?
Or tic-tac teeth?
But it's the first time I heard of it when I put out that question.
Really?
Yeah, so my head's totally buried in the sand when it comes to this. I was laughing my head off getting these messages in last night.
Shark teeth, turkey teeth, tic-tac. There's loads of great names.
Okay.
But the apparently with these turkey teeth, as we say, or any as dental tourism teeth, like someone has said to me that their friend was offered a cheap and expensive version of the tooth, and it was plastic versus porcelain.
Okay.
So the difference of that would be that, like, first of all, plastic just shouldn't be in your mouth, and second of all, the porcelain is fired by the ceramicist, the lab person, and it makes it less porous. So there's less holes in it, and the plastic obviously has loads of holes in it. So if there's if the holes are bigger, the bugs will just go down. They will rot the tooth underneath. The bugs will attach to the gum line, so where the crown joins the tooth, that's called like a margin, and the bugs will just attach to that and you'll get your gum problems, and that's how that comes in.
But is there much of that goes on that people come out with plastic teeth?
Like sometimes it is.
Oh my goodness.
Like, so some people are going for the cheaper version because, I mean, otherwise they wouldn't be selling them. Now it's way more infrequent that like I would get them and stuff, because they do end up just getting sent to the hospital because the problems end up being that big. Also, like my undergrad told us never to treat someone who's gone abroad, and it's because it is the last person to touch. You're going to become responsible for that treatment, and your insurance won't cover it. And I know that sounds so bad, but like we need to work insured, and ours won't cover that. So if something goes wrong with someone in turkey teeth, that's putting us liable when that person has gone abroad for the treatment. So if something goes wrong, what you're actually supposed to do is go back to the dentist who did it in Turkey in the first place, which you're going to be very reluctant to do because at that point you're nearly scared of them. Do you know?
So you won't see someone who comes back with issues.
Like I'd give them an antibiotic.
Okay. And then, so do they have to go to the dental hospital in that instance? They'd
have to go to the dental hospital. Sometimes if you're lucky, you will get like the people who have gone on to do like prosthodontics. So anyone who's done like a postgraduate in a finer subject in dentistry. So like your root canal people, your endodontists, they're your endodontists, your prosthodontists are your crown people. And that's just because like their I guess their postgraduate degree is kind of counteracting the insurance.
Okay.
Like
yeah.
Their qualifications nearly outbidding it, if that makes sense. So that would stand to them if anything ever happened. But they will charge way more. Like way more than starting in the first place because they are fixing a problem. And like what's really disheartening is that like most of the time these problems don't even exist in the first place. And then they're coming back and they're getting all these extra problems and they're being charged way more in the long run. Like I have had people that have like inflamed gum disease and it will not go away from like, I've seen this come in and they've been in pain. Like there was one guy that said he was in pain for like 9 years and he's got this beautiful set of teeth, but like he can't eat and he's in constant pain. So, and I think people forget about that. They get caught up in it.
Are they the outliers? Are people going over and getting good jobs done? There's
definitely people that are going over getting good jobs done. It definitely depends if you are researching it properly. I definitely say like what I say is always try to get someone who's fluent in the language where you're going, make sure that they're covered insurance wise, make sure that they're using the proper materials, check their qualifications, make sure that they're up to the standard. Like have they done cosmetic courses? Is the dentist doing the exam? Like there's loads of stuff to be sure that this is going to be like more in the safety realm. Like there's always going to be risks with everything. But there's like, what I'm always trying to say is I'm not trying to turn people off going. It's just you have to be way more careful than what people are being.
Okay.
You know, and like if you are getting a crown in Turkey for €300, there is absolutely a problem with that. How can you pay a dentist, a nurse, a receptionist, insurance, materials, rents, a ceramicist? Like when you add all of that together, something has to give.
Okay.
Like it just has to. And often it is the ceramicist that's first to go because you can apparently, again, bulk buy like crowns and stuff from places like China and it's one size fits all. That's why you're getting these big fake teeth.
Okay, so they're not being made specifically for your own mouth. But then don't people go up the north for cheaper dental treatment as well?
Yeah, and that's just different rents, different like minimum wages, stuff like that. Insurance is different up there. Like all of those things are like the same again. But again, I would still, anywhere you go, I would still look in, has that person done a lot of cosmetic work? Because if it's not something they do often, they're not going to be doing it to that standard. And that's just like everything. Like practice does make perfect. So no, I wouldn't go up there if they're used to doing like, or going to a specific dentist there. If they are doing like one small makeover a year, but there's phenomenal dentists up north in Turkey. I'm seeing them all the time on Instagram. I even chat to some of them in the UK or up north. Like there is really good dentists out there, but it is just about like researching. And I think a lot of people are doing minimal research and they're also still going for the cheapest option. And the chances are it is not going to work if it's the cheapest option. Okay.
And then for dentistry, so dentists can do veneers and crowns and all that, but it's orthodontists that do the braces and the changing of teeth, the shape of the mouth, etc. Is that right? Is that strictly true? Can you tell me the difference between the two?
So an orthodontist is someone who's again done a postgraduate degree in moving teeth. So they will end up just only moving teeth in the long run. Sorry.
Take your time. Do you want a little glass of water?
Yes.
Okay. You are doing an awful lot of talking and I am firing the questions at you. My apologies, but I'm trying to get them all out because I'm actually finding this really interesting. So take a few deep breaths.
I feel like I'm on a first date and I'm talking too
much. No, it's fine.
But
you are giving me lots of information. So do you know what? I'll tone down the question rate per minute, and you can feel like as if you're not being interviewed for your next job, okay?
I can't even remember the question.
So the question was the difference between an orthodontist and a dentist.
Okay, so an orthodontist then, because they've done those extra years, they will generally only do braces then. So like my dad is an orthodontist and he will only do braces because you're not going to do that extra slog and then go and do fillings and stuff. But then your Invisaligns and stuff came out and that was more like let's say like you're working with a technician. So there's two of you working on it, and the technician is trained in orthodontics. So it was kind of helping the dentists more. And then you were getting trained in like Invisalign specifically and stuff like that. Now you are trained in your undergrad to do braces, but they definitely don't do it enough for the standard dentist to actually follow through with it. To be honest, I think like if you haven't done enough, you're not going to have the confidence to do it when you get out in the real world. So a lot of general dentists don't do braces because of that. Now you are still like able to do it if you have like, if you go on your courses or whatever, like you don't have to do the postgraduate degrees. You can just do like courses or masters or like work alongside, like I worked alongside my dad for years to learn my ortho. So obviously that was very lucky situation. But then that's why a lot of standard dentists will just stick with the plastic retainers, the removable retainers like Invisalign or any of the other ones.
And what are your thoughts on those Invisaligns versus, your standard metal braces or whatever they put, those? They
work to a degree.
Mm-hmm.
I definitely think they're better if it's like a relapse situation, meaning that like if you had braces before, rather than like teeth coming out left, right and center, you're definitely going to have to get into the braces probably. The thing about the Invisalign is, and all of them, sorry, also not, like I feel like I'm just mentioning them. I'm going to just call them clear liners.
Is Invisalign a brand?
It's a brand.
Okay, I understand then. So that's like me saying Valium versus diazepam.
Yeah.
So maybe just, So
clear liners.
And do you want to actually explain, because there's probably people out there that don't understand what clear liners are. So maybe explain what they are first and then...
Yeah, so, and just on that note, the reason that Invisalign got the name was because they were the first. And that's the only reason that so there is other brands that are coming out and which not, but like they've just become like the Rolls Royce or whatever. But what the clear liners are is they're plastic films on your teeth, kind of. So they're kind of like really skinny gum shields, and they lock your teeth into the aligners and they move your teeth by slightly adjusting the teeth position each week. And then you'll have like loads of weeks of aligners and you'll change them each week or every 2 weeks.
So they change size. Are they plastic? Because you said about plastic in the mouth though wasn't great. So
but these are like they're not as porous. So like the plastic that I was talking about before. So even when you make a temporary crown, the material used for that is really porous, and it would be a prime example of something that's not great to have in your mouth. But it is fine for 5 weeks.
Okay.
So a lot of the materials in the industry have like finite time frames, and even like those aligners, like they'll get more flexy if you keep them in for a year and they will end up not doing anything. Like everything just has a lifetime.
Okay.
So they will lock into the teeth. Sometimes you even get like little white filling buttons on your teeth to lock into the teeth and move them. They're great if you're going to comply.
Okay.
So you need to wear them 22 hours a day. If people ever waver and are like, ooh, I don't know, I'm like, you're not getting them. I'm just making that decision for you.
Okay.
Because the treatment's just not going to work. And it's frustrating for the patient. It's frustrating for the dentist, like that, like this patient isn't getting through it. And like then in that case, then the fixed braces are better. You put them on, patient has... This is going to sound bad, but no control.
Yeah.
It's completely...
Just the way you like them, Bronagh.
Just the way I like
Sit into that chair now and open your mouth. I'm going to stick my hand in.
But it's much better. Like
we were talking earlier about the fact that people feel that they don't have control on the dentist. And now we know why.
I swear I have a stop word.
Oh, it's so funny. You have a safe word, do you? It's like tap 3 times, like at the UFC. Okay, so the Invisalign work if people will comply and if their teeth aren't really kind of coming out in different directions.
Yeah, you're just going to be, do you know what the thing is if they're in really different directions? I'm sorry to cut across, but is that like you end up losing your motivation to wear them. So you may originally in the first 4 months be unreal at wearing them. And then you'll be like, God, the process I've seen, like the progress I've seen in this time, I'm not bothered. And you will lose your interest.
Okay.
So that's why, even if you think you're really good, I'm like, unless you're like fixing up for like a wedding or a graduation or some fine adjustment, just get the braces on and you'll get it done. You will get it done so much faster. If it's the smaller things, it's pretty much the same time frame. So that's not something I ever tell people to worry about, like to pick it on. It really comes down to, are you going to wear them? Are you not?
Okay. And you can't get orthodontic treatment abroad as such. Is it more that's definitely something that needs to be done because you need close contact with your orthodontist?
Close, yeah. Like you need to be seen about every 4 weeks.
Okay.
So it's a lot more appointments, and that is one of the reasons why it is never seen really abroad, is because that it's basically the substitute to orthodontic treatment is the people decide to get crowns or veneers to hide the crooked teeth. And if it's going to be really hard to do without a drawing, but if you have crooked teeth and one is sticking out really far and you have one back here and you don't want braces, the next option would be theoretically to do crowns or veneers. It's definitely not a good option, but because you have to, but this is why it'd be more popular in abroad, because it's a treatment that's a substitute to braces, which are expensive. I mean, all of dentistry is an investment. It's not just like you wouldn't go for a cheap version of an arm. Like it is all an investment. But the teeth, if you have one sticking out really far here and you want to make them look like straight, you're going to have to cut this one all the way back.
You're going to have to cut the front one all the way back.
Cut it all the way back.
Instead of layering up the one that's behind.
Well, you're going to have to do both.
Oh, okay.
And there's going to be problems with both, because you're going to have to file that back a bit, because this one is probably sticking out like Bugs Bunny a little bit.
Yeah.
So you're going to have to cut that back. You're going to interfere with the nerve.
Oh God, even the thought of that now, I'm actually getting a bit shivery.
Sorry.
Yeah. Ooh.
We should do a disclaimer here. It's going to get interfered though. And that's when you get your root canals. So like even with that message from that clinic abroad, which by the way, they only took 2 photos of my teeth, but they said they did a disclaimer and they were like, by the way, any one of your teeth could need a root canal.
As in, after we treat it, they could need a root canal?
Yeah.
And that's because you could damage the nerve?
You could damage the nerve. And that is...
Okay, sorry, go ahead.
Oh, sorry. That is a risk with all crowns, veneers. 1 in 5 will die in the next 5 years. That is...
And that's in Ireland too?
In everywhere. Or sorry, in the next 7 years. And that's everywhere. That's a risk. Definitely needs to be brought to their attention, but there's no way they should be they were nearly guaranteeing it.
Okay.
You know, that kind of way. And a lot of the time with these people that go abroad, you're asking, do a lot of them have problems post? No, they don't. But a lot of them don't. But a lot of them would have got the root canal, which is damaging probably a perfect tooth. So no, they're not in pain. Yes, they're able to eat. Yes, they're able to speak. But when that needs to be replaced because there's so little tooth structure left, they'll probably need an implant in 10 years.
So when they're getting the veneer done, they get the root canal at the same time?
Yeah.
Oh, because of the damage that's potentially done?
They will have just cut right to the nerve.
Oh my God, okay. And sorry, can you explain what a root canal is, please?
Sorry, yeah. And just by the way, I know you're like getting all, but you are numb. You have to remember for these treatments. Yeah. It's just a lot of time people are worried about that kind of stuff. But a root canal is a filling in the root of the tooth. So your nerve starts in the top part of the tooth, which is called the crown, which is the white part that you see in the mouth. And then the root is the part that keeps the tooth in place, and it goes right down into the bone. And the nerve travels all the way to both parts.
Okay.
To the top crown part, right down to the root. And that needs to be removed when it's damaged, because the nerve will die off and it will necrose, which becomes like pussy basically. And that needs to be cleaned out. So you put a filling into it.
So you take the root out, and is it...
The nerve and the root.
Oh, sorry, the nerve. So what does that look like, the nerve? And is it tiny? Do you need like teeny tiny little...
It's actually, do you know what? You're definitely thinking about what I thought it was going to be before I did a root canal.
Okay.
I was expecting to pick out a nerve.
Yeah.
It's just blood.
Okay.
Yeah, it's so disappointing.
Oh no, I expected the way you see the pictures of the nerves, like big long wiggly things. You don't pull that out, it's just blood.
No, just blood.
So how do you know you have it then?
Just blood, and sometimes it's like pus, or sometimes you'll get no blood if the tooth has died off. How do you know you got it? You know, because you just have to do such vigorous cleaning. Okay. And that's why even with root canals, there's a percentage of failure. Like, do you know, there's 90% on a tooth that hasn't fully got pus yet will be success rate. If it's got pus, then you're down to 80. If you're doing a re-root, then the percentage goes down again. So there is a percentage of failure with root canals. Like, all of it comes with risks of thing. And that's why risking getting a root canal.
Okay.
Like, you're going to, and again, everyone's going to probably not be very happy with me, but they were saying the root canals were going to be 150
euro.
150 euro.
And how much are they here in Ireland?
That's the average price of a filling in Ireland.
Yeah.
And a root canal, an average price is anywhere between 8 and 9. 900. So they can't be spending a lot of time doing it.
Okay.
Like there's no way you could be spending
even given
time.
the differences in the cost of living, rent, insurance,
even
everything.
with it.
Okay.
I actually would love to know how long they spent doing those root canals, but a lot of the time when they come back, they're not satisfactory. And that's something that's very blanket, because like that is stuff that you'd see on x-rays very clearly, and they're very rarely satisfactory. To be honest, root canals, I really think best done by an expert.
Okay.
By like a root canal expert, because they are the foundations of the teeth, just like the gums, and that always gets overlooked when people are going for cosmetic work. They're like, oh, it's going to look pretty, but the foundations, and this is coming from someone who's cosmetic focused.
Yes.
The foundations are absolutely the most important thing. Until you have got like your oral hygiene in order and you're looking after the teeth, like that's why braces is the absolute best way to go to protect your teeth, because at least they're your teeth. And most of the time when you get braces and whitening, you're actually happy with your teeth afterwards, and you don't get anything.
Okay.
You don't get anything done to them. And then you have minimal upkeep apart from your 6-month checkup, compared to when you're getting these like crowns, bridges, all of that stuff. Bridges I know are put in there to replace the tooth, but for crowns and veneers, like they're an average life expectancy of 25 years worldwide. That percentage is, that's taking in all the good dentists, all the bad dentists.
Okay.
And so I feel like when I did my detectivism, I was coming at them a little hard hitting, so they weren't really answering my questions towards the end. But I was trying to figure out how, which I actually think is worse, because if I was a patient, I mean, you're supposed to answer these questions, I'm entitled to know. But I was asking when they need to be replaced, because I'd heard through 2 people that they were guaranteed 10 years on the treatment. So not the 25, the 10. And every time you remove it, I mean, you could argue that the tooth is going to be more prepared, and like, even like with that tooth that's fully cut back, like there's very little to work with if you have to keep cutting on it. Do you know, that kind of way? Obviously you're going to try to be minimal. But anyway, as someone that I know, they were given 10-year for each set, and they were only going to be allowed to get it 3 times, and then the teeth were going to have to come out.
Oh goodness.
And that's what they said to them. And I feel that a lot of people that go abroad don't even know to ask that question.
Right, okay.
Do you know, that kind of way?
Yeah.
I mean, it's not something that's on your mind, because when I asked on my messaging, I was like asking them, and then I was saying that I was planning to live till 90 at least, and they were not answering me. I was like, I don't want to be in dentures when I'm 90. And they just wouldn't answer. So like, I'm taking it from like the 2 other people that I've heard. It's like, you're getting 10 years out of them. So like, if you're my age, quick math, 57, I'm going to have no teeth.
Okay.
I'm still open to be making shapes at 57. I don't want to have no teeth.
Yes.
And like, it's the long-term complications of it compared to like your braces. I know I'm really vouching for them. Definitely a daughter of an orthodontist, but I just...
No, it does make sense. And then, sorry, does root canals cause the teeth to discolour and die and go a bit brown or yellow?
Depends if there's trauma.
Okay.
So, and like, I mean, yes, any tooth that's had root canal, it depends on how long it's been left infected. It's not necessarily a hand-in-hand situation, but yes, often if someone has a discoloured tooth, it's either had trauma or needs root canal.
Okay.
Yeah. But sorry, on that, I just want to mention this. This guy's getting cut back that I was saying earlier, which is why we got onto the root canals. And then this guy's stuck back. But because you can only cut this guy back so much, you also have to build up this guy.
Okay.
To make him in line with this one. So
Bronagh is making lovely hand gestures where one hand is much further sticking out than the other. So it's her crooked teeth.
I told you I was going to need pictures.
Yeah. No, it's good. I'm just trying to draw a picture. I'm trying to draw a picture in the mind of our listeners.
Yeah. So basically I'm saying if someone's got one Bugs Bunny tooth going out and one stuck right back in, you're going to have a midway where one's cut back and one's built forward to get to the medium line, let's say. And now, because you're building one up, you're getting a shelf on one of the teeth at the gum.
Oh yeah.
And there you've got your gum problems.
Oh goodness. I never even thought of that.
Yeah. So that's why people have really flaming gums, raw red, they will have like gum disease for like the rest of their life, or they'll be told to see the hygienist like every like 3 months when they didn't need to in the first place, you know. And that's what it really all comes back to, is you're getting this work, this cosmetic work for the sake of aesthetics, like, and you're jeopardizing your health and your sanity for not being in pain just to have more perfect teeth. It does really like baffle me. And I know everyone wants a perfect smile, but there just is cheaper options in Ireland. They're not comparatively cheaper, but they are cheaper, because the Invisalign, hypothetically, or clear aligners is around 3,500. And the 20 veneers for me was 6,500 abroad.
Okay.
So I actually saved $3,000 by being here, but yes, I'm not getting the same treatment.
Okay. I thought people got veneers because they wanted their teeth to be white.
So the whitening, you were talking about them like looking chaotic. The white of the veneers should match the white of your eyes.
Okay.
To not look funny. And it's porcelain can go to way different shades than teeth. So if you whiten teeth, they will never ever look fake if they're your own, in my opinion. I've never seen it. Like, it's just not a thing. And compared to porcelain, has a whole different shade guide, and you can get super white teeth. But even at that,
just thinking, some of those pictures that go around
with Ross Geller.
Yes. But there are people that have teeth like that.
Yeah, and
or else they've top teeth that colour and the bottom teeth aren't the same. And so you do wonder who did this to them. And
that is literally what I was going to say. That's poor recommendations by a dentist. I mean, we were always told in college, never show a patient a shade guide, because you pick it, you show them two, and that's their choice. And it's because most people will walk in and be like, I want the brightest one.
Okay.
Because they're like, oh God forbid it's not wide enough and I've just spent money. Like, you're being, half of like what you're being paid for is your expertise.
Yes.
All of it nearly. So you're supposed to be advising people, like, just as if I went into a pharmacy, I wouldn't just start going and giving myself my own
all the drugs. You might want to, but you wouldn't be allowed.
You wouldn't let me.
No. Okay, that's interesting. And then, because we're talking about the teeth whitening, that is something that's very, it's really come into force in the last few years. Certainly all the pharmacy teeth whitening kits. I never would have seen that before. And then also, actually, interestingly enough, when I was in New York a few years ago, people were saying, bring me back the Crest teeth whitening strips, because apparently they're a much stronger percentage of teeth whitening or hydrogen peroxide than is allowable over here in Ireland. So can we talk about teeth whitening, the strips, the dental, the toothpaste, all of that? And is it damaging for the teeth? Is it okay for the teeth? I did put the Crest on. I kept them in all night and I couldn't drink a cup of tea for a week. So that was me then. I was done. So can we talk a little bit about them?
I'd love to talk about
this.
Great. So as you said, the percentage in Ireland, or in the EU actually, isn't more than 16%. Originally, actually, when it came out, it was like America, and it was up at 35%. And funnily enough, my dad was given samples and he gave them to me and told me to use them. So, and wouldn't have, before the legislation came in.
You're your dad's guinea pig.
I clearly was at that point. But definitely wouldn't recommend, as you said, very sensitive teeth afterwards. And the thing is, 16% does the job. And a lot of the time when patients, so there's different types of whitening. There's your light whitening. Some people might know it as Zoom. And again, that's just they were the first to do it kind of thing. They got their name out there.
This is the thing that you stick in your mouth and kind of it flashes.
The blue
like UV
light,
is it?
Yeah, that you get done in the dentist chair. Now, I would absolutely not recommend that.
Okay.
Ever.
There's like a take-home one as well, isn't there?
Ever.
Okay. Okay,
but
great. Why?
But if it's the take-home one, I actually, apologies, I haven't looked into that. But so just coming back, if it's over the counter, it cannot be more than 0.1%.
Hydrogen peroxide?
Yeah.
Okay.
Like blanket. And like in the clinic, we use 16%.
Okay.
So that's a huge difference. So for example, the toothpastes have little bits in the toothpaste, and they basically are scrubbing off the top layer of your teeth. You're getting sensitive teeth and you're getting yellower teeth.
Euceral tooth powder comes to mind. It actually feels like grit when you're brushing on your teeth.
Yeah.
I used to use it a little bit, but I totally stopped when I looked at it and saw what the hell was in it.
The things, it's like those bitty exfoliators on your skin. Like so
you're scratching the top layer of your enamel off your teeth. Is that it?
Yeah. And you're thinning it.
Okay.
So in the long run, you're going to have yellow teeth. You're going to have sensitive teeth. So like they just don't work. Like they're going to just scrub off the stains and that's it. And a lot of people, they come into me for like professional teeth whitening, and the one that I would use and I would recommend anyone to use if they go anywhere else, just broadly, is that I would say people that say to come in and get the professional whitening, they often say to me afterwards, God, I wish I got this sooner because I've spent so much money on strips, toothpastes, all of this stuff, and it never worked as much. And they actually spent more. I mean, those, like with the whitening stuff, isn't like cheap either. And if you add it up over a couple of years, like that at home professional whitening, 85% of people say it lasts 5 years. And then what I actually tell people to do so that you never have to go through it again is to just whiten your teeth with that leftover paste or get a new bit, is to do it once a month. And then you're going to also kill the bugs on your teeth superficially. Obviously, if you've got like loads of decay or caries in your mouth, it's not going to work. But it can actually help the health of your mouth because it kills the bugs on your teeth and gums.
This is the stuff that you have to buy this in the dentist though. You can't get this over the counter.
Not over the counter because it's prescribed.
Okay, fine. It's prescribed by the dentist and you provide it in the dental surgery, because I've never had a prescription for something like that.
Yeah, no, it's always provided in the dentist, but like I'm just trying to make the differentiation for people.
Okay.
It is technically a prescription item.
Okay.
And so it will be given by a dentist, and then like your dentist should or probably will supervise you to make sure you're not having any sensitivity, that it's actually working and all that, and work up, like, so you'd normally start on 10% and work up to 16% of that peroxide to get those results. And then that actually, I think that works a charm, and then you're not like doing all those other things and it's not damaging on your teeth. So that's probably a question that people have asked, is that like what damages your teeth? And the at-home whitening won't damage your teeth, because what it does is it oxidizes the stains, which is break down the stains in the tubes of your teeth. So your teeth have tubes in them. They're just loads of tubes or crystals, and the stains get lodged in them, and the peroxide will go down and break up the stain. So it doesn't actually interfere with your teeth at all. Now, why you're getting that sensitivity is just that the tubes are now basically cleared out, and what you're going to get is a transient sensitivity with at-home whitening. With the light whitening, the blue light, the Zoom, whatever people call it, and it's done for an hour in the chair, it's actually double the price as well, is that it's not transient sensitivity because it actually damages the teeth. And it damages because that blue light is attracted to the darkest thing in the tooth, which is the nerve, the blood supply. It's not the stains. So it bypasses the stains and completely focuses on the nerve. So you get permanent sensitivity.
Oh my goodness, that sounds awful.
And that's why people like afterwards will be like, oh my God, I can't ever whiten again because like that. And that's what they're referring to when people are having this problem.
So do dentists do that? Or is it more, there are places that say teeth whitening, they specialize in teeth whitening. Are they dentists that do that? Or are they?
I know that there is some places that
we're not going to name them.
No, I'm not going to name them. I don't want a bullseye on my back, thanks. That are doing it, and I believe there's no dentists in those places.
Okay.
But the EU was very strict. They did have a big thing about this at the time of who was allowed to do it, and would they allow like non-dental people sell it, mainly like beauty people. And they had decided that it was a risky enough procedure that not Tom, Dick and Harry can do it. And the reason for that is you need to have a dental exam first. It's not that it's super dangerous. It's that if you have decay on your teeth or need cavities, it's going to kick that off. You're going to need a root canal then. That's the biggest risk with it. So it needs to be that's why it needs to be under the eyes and supervision of a dentist. It's not that is particularly dangerous, but like, I also don't know what settings they're using. I also don't know who's training these people, because it's kind of like the filler, I guess, isn't it? It's like or the facial filler, in case I've changed too much there. It's who's training the people. And like, I know for myself, like here, it's not legislated again, but no non-medical person will train a non-medical person. Mm-hmm. So that's like, so I don't know who's training these whitening people, but I believe there's no dentists in them.
Okay.
But there is dentists that do the other light. There is, and
they just do them.
They just do it because, and I think it's because the demand's there. People want the quick fix. It whitens your teeth in an hour versus the 6 weeks of that home whitening. So, I mean, there's people that have come into me and I'm like, it's going to take 6 weeks, and they're like, no. And I will tell them the risks of the other, and they'll be like, no, I'm going to go do that.
And that dental whitening that you recommend, you sit them in the chair initially and put it on, or do they just take it home with them? So
you take the molds first, and then you'll give them trays 2 weeks later, and then I'll give them their 10% box, and then they'll come back 2 weeks later, then I'll give them their 16%.
Okay.
And I'll see them every 2 weeks. But they will do it at home at night time.
Okay.
Yeah.
And then the teeth whitening strips that we sell in the chemist then, are they worthwhile? Do they work? Or
they just won't.
Just very temporary.
They're very temporary. So they generally lift like one shade for 24 hours versus your professional whitening is 3 to 4 shades for 5 years.
Okay.
So that's it. Like, so yeah, if you want a real quick fix before going out, the strips, they're not as bad as the whitening toothpastes because they're not abrasive. Okay. But they're just not going to last.
And those Crest ones that have 35% hydrogen peroxide, what do you think of them?
They actually, yeah, I mean, they work.
They work.
They work, yeah. Do they work? The biggest problem with them is the supervision thing.
Okay.
Do you know that kind of way? Like if someone hasn't seen the dentist in like 10 years or like, or like it doesn't take that long for filling to be required. If someone hasn't been to dentist regularly and then they start whitening, you're going to cause bigger issues. That's the problem. Okay,
but are they as good as the ones that you do in the dental practice? They're only 16% though. The Crest ones, as we say, they're a higher percentage.
Percentage.
But you were saying that the hydrogen peroxide doesn't actually cause tooth damage, even though it causes transient sensitivity. So
it doesn't actually interfere with the tooth structure.
Okay.
Yeah. They're very wishy-washy on the papers about it, but it doesn't actually, because it only acts on the stains. It doesn't actually act on the teeth, but it's removing something that shouldn't have been there in the teeth in the first place.
Okay.
That's how it doesn't interfere, if that makes sense.
Yeah, no, it does. I'm just wondering, like for people that can't afford to go to the dentist to get it done, but I suppose they can't, and if their friends coming back from America, like would the Crest ones, work as well? Like, I mean, like, definitely give them a try if you want, but just see your dentist first. Okay. Do you know that kind of way? But like you're saying about, and I know there is like people, not everyone can afford to get the cosmetic work done, but like it is a cosmetic treatment at the end of the day. Just like if you can't afford to get highlights, you don't get highlights. If you can't, like it is like an actual thing. Do you know that kind of way? Like it is something that you have, like everyone has to save up for it. It's not just something you walk in and do on a whim. Like it is something that, as I said at the very beginning, it's an investment. And it's like all cosmetic work should not be just done lightly because you really want it and you want it now. If you want it, like, version,
and you can get it cheaper, you do need to put thought into it and like save for it, like ask for contributions for birthdays, Christmas, whatever you need to do to and like think about the long-term plan. Because if you, again, I don't want to keep diverting back to the dental tourism, but like if you do it now and then you have to do it again in 10 years, you're down another 6.5 grand in 10 years. Yeah. Like every time you do it, like just try to think about the long-term thing. And a lot of places do payment plans. Okay. That's another thing in Ireland. Okay. So it is just, it's just finding a situation that suits you. But I definitely, the cheapest solution is never really the right solution. Okay. And I really don't mean that from a sales point. Because I know that's so hard. Can I ask you now about a few questions come in about the fact that a lot of dentists aren't seeing medical card patients now? And can you maybe shed a little bit of light on that, please? Yeah, so it's just there's very limited stuff on the medical card in terms of what dentists can provide. It's like one filling, one clean, maybe even an extraction. And first of all, they're not subsidised correctly. I worked in the HSE for the first year when I graduated, and they were cutting funding left, right and centre. Like they are cutting funding all over the shop for dentistry. And it's obviously awful. But they're not, because they're cutting funding, they're not paying the dentist properly. So it's not worth people's while when the cost of living and rents and everything is going up for the dentists and the practice. I mean, we have to maintain with the rest of the world, and you just don't get paid enough. And you're getting like, it's really disheartening as well, I think, from a dentist point of view, to just constantly be like, sorry, you're not qualified. Sorry, you're not qualified. Sorry, you're not qualified. And then that's
what happens, is it?
And it's what happens. And then this is awful, but they do get pinned, but I can't afford this, and help me. And like, people play on their like health professional ethics, and they play on them like to just treat them. And I've seen it happen. I've heard it happen, and it's a really awful position to be in. So I think people just want to remove themselves from that situation, because they're like, I feel like an awful person when I leave work and I can't actually treat people. And that's definitely where I stood when I was in the HSE, just feeling like I was so helpless with my hands tied behind my back. Or like, even in the dental hospital, they take my medical card. And I remember this time, and this girl came in, and she had a perfect tooth for a root canal. Only a dentist would say that. But anyway, she was 16, age of consent, and she said she wanted the tooth out. I was like, that is the wrong thing to do. And she was like, but I can't afford the root canal, and I was like, but you don't do it. And the supervisor was like to me, you have to do it. You have to just take out her tooth. And it was just because she had limited finances, and there's limited funding for the medical card.
Does the medical card not provide a root canal?
No.
Why?
But they provide extractions. So like that's still engraved in my head 7 years later.
But it's easy to pull a tooth. It's not easy to do a root canal. And so it's the quick time and the effort.
Time.
So why do you think, because I think that, and I know that as we, I suppose years ago, maybe Ireland versus America, if you saw an American smile versus an Irish smile, you could spot the difference in the countries. We've come a long way in terms of what we want from the look of our mouth and on our smiles here in Ireland. And I know that you say aesthetically, and we're talking about cosmetics, but there's an awful lot of psychological importance that people will place upon the way they look because of their teeth, be it that their teeth are crooked, that they, are unsightly, they're afraid to smile. I know children that don't smile in pictures because their teeth are sticking out and they're not yet at an age to get orthodontic treatment. So there's that. And then there's obviously the decay and just the general oral hygiene as well. Why is there not more of an emphasis placed on the importance of dentistry in Ireland?
I know. I ask myself that all the time, because again, when I was in the HSE, they'd cut another class, so they were doing. I don't know if they're doing it anymore. And again, not having a go at the HSE, but we were doing 2nd and 6th class at the time, and they'd also cut back the braces thing. So the way some children can get it through the HSE, and it's if the teeth are.
They have to be in an awful state.
Really, really bad way.
I have 3 children, and like 2 of them will definitely need orthodontic treatment. One of them went to the dentist, that free scheme. Yeah. And it was just that free appointment that they all get. And the dentist picked up on the fact that his jaw was misaligned and he'd need an orthodontic brace. It was like a retainer type thing put into his mouth that he'd have to wear for 6 months or a year to realign his jaw. Otherwise his jaw might move forward or something like that. So we just went to an orthodontist and paid for it because we were able to do that and we were lucky enough to afford it. But I asked her if we went public, how long would it take? So my child was, I think, 8 at the time that we got this done. And she says, he may not be seen until he's about 13 or 14. But sure, by then the facial structure has totally changed. So I just think that it's terrible that you know, your teeth have to be in an absolute jock to be seen.
But that, and also, sorry, I love that word, jock.
But that's, you know.
But also, it's a 5-year waiting list.
Yeah.
So, like, even, so if you were to go at, like, I think we were screening them at 10, and it was a 5-year waiting list. You missed the growth spurt. Mm-hmm. And for children orthodontics, that is so vital to not miss that. And it's missed. So they're getting compromised results.
What age is the growth spurt?
It's 13, 14.
13, 14, yeah.
Yeah. So, I mean, you've missed it, and like, you're going to get compromised results at a later date. And like even people that were getting on it at like the grade 5, I was being like to them, honestly, if there's any way you can pull it together, try to, because it really is so big, that waiting list.
Yeah.
And there's so little resources given to the HSE for dentistry. And like, they were cutting another class, and I never understood, like, back at the time, like, why they don't reinforce prevention more. Like, if they have such limited funding, why they don't be going into schools more, why they aren't showing people how to brush the teeth. Like, I remember the other day I was saying to someone about the 2 minutes, because I actually had cut mine short, and they were like, what are you talking about? Like, some people don't know the basics.
So tell us the basics now.
Of thing. I'd love to. So it's like brushing your teeth for 2 minutes. It's don't rinse after brushing your teeth. It's brushing in the morning. I know there's loads of arguments about this, but I always say to brush after your breakfast.
So sorry, what's the argument? Brush after your breakfast.
Before or after your breakfast.
But what's the argument? If you brush before your breakfast, you're just eating on top of it, and you're causing more bacteria to grow, no? I would have thought. So who says brush before breakfast?
Honestly, loads of people.
Like loads of dentists?
Yeah, and I've actually looked into it though, and it's just not right.
Okay.
Like, to be honest, again, it's one of these things that have a minor discrepancy, but it's something that people always ask, so I do like to address it. But it's that, so if you brush before, you remove the protein layer on your teeth, which is a protective layer, and that takes 2 hours to rebuild. Mm-hmm. And so then when you eat your breakfast, any acids created, it doesn't have to be an acidic drink, any foods are going to create that acid in your mouth. And that is going to create more damage on your teeth than if you have that protective layer on your teeth when you're eating, right?
Okay.
But if you brush after, that acid attack in your mouth happens for half an hour, but up to an hour. But most of it has finished at half an hour. So if you brush half an hour after brushing your teeth, then you have that protective layer and you've waited the half hour, and it's a shorter time frame to wait than the 2 hours. So that's why.
Okay, yeah, I would have thought so.
Yeah, it's
manual or electric toothbrush?
Again, the papers are 50-50. It is whatever suits you.
I knew you were going to say that.
Did you?
It's almost like, what SPF should I use? It's whatever one you'll actually wear. You know, that kind of way. That's the answer. It's whatever one you'll wear. It doesn't really matter. Obviously, it's important to use the zinc ones, but if you don't like them, just wear a sunscreen. Isn't that right? So it's whatever one suits you. Because I actually feel, so I've been using an electric one for years, and I feel dirty if I use a manual one. I feel it doesn't clean them as well. Yeah.
Yeah, like I'm a big lover of the manual toothbrush.
Are you?
Like, huge. And I decided to test out the electric toothbrush, and it got to a point where I was using it with no charge.
Okay.
I'm just not that way inclined to charge stuff. Like, okay. I'm not very techie, even like with my phone, like, and stuff like that. So it just didn't suit me. And so there was no point in me using an electric toothbrush if there was no charge on it. So both of the toothbrushes have different techniques. And if you do that technique right, then the job's done.
Okay.
But if you're not doing it right, then switch to the other one. So like, there's some people that just can't master a manual toothbrush. And
tell me how you manually brush your teeth then with a manual toothbrush.
With my demo.
So
audioly.
I think you're going to have to verbally explain it, but I know there's a thing of like brushing from the top down, isn't there, or something like that?
Yeah. So with the manual toothbrush, you're brushing in a circular flick down motion. So you angle it up towards the gum, the bristles, at a 45-degree angle, and then you circle and flick down.
Okay.
Yeah. And the circle is to complement the circle contour of the gum. And that's why then with your electric toothbrush, I prefer the circle heads. And I know a lot of them aren't circle head, but the circle will pop into the circle contour of the gum and match that and actually clean it.
Okay.
So I love circle head electric
So
toothbrushes.
so down and flick, and then what about across the molars at the back?
So just brush across the tops.
Okay.
And then when you're just make sure you always feel like you're looping around the back teeth. People always just forget in by the tongue, down at the bottom on the back teeth, and it does feel kind of gaggy. But if you're not doing that, you're not getting it.
Okay.
It's kind of simple as feel yourself loop around the back tooth, and then for the top teeth. People are always trying to open really wide to get to the back teeth to have a good look at their back teeth, and that will actually move the bone forward.
Okay.
And it stops you actually accessing those back teeth. The toothbrush can't fit back.
Okay.
So when you're getting to the back teeth, only open your mouth halfway, maybe even a little less, and you're actually brushing the back teeth blind.
Okay.
Without seeing.
Okay.
Yeah.
What is the best toothpaste on the market? You know, what should people be buying?
Anything that's not whitening or charcoal.
Okay, lovely. Anything, and fluoride necessary or unnecessary?
Yeah, absolutely.
Okay.
Yeah. And actually, like, there's all the kids ones and stuff. Once they're 2, you're on to the adult, if they can stomach it, like if they can.
Yeah.
Taste wise.
And what age should you start brushing children's teeth at? As soon as they get their little tootsies?
As soon as for the routine.
Yeah.
And if you can't get a toothbrush in, at least get a finger in to try just swab. Like, you're even supposed to swab the mouth with a finger before the teeth to just get routine in order.
Just get them used to it.
And get them used to having something in the mouth.
Okay.
Yeah.
Flossing, very important.
Only after 13. It is very important though to use something between your teeth. I prefer the little interdental brushes. And it's just
They're
because.
a pain in the ass though.
Do you think? I think floss is a nightmare.
I stuck one of those interdental brushes in between my teeth. I couldn't get it back out again. I was walking, like yanking. I felt I was going to yank my teeth out. I know. I probably used too big a brush in between my little. I don't have very much in between my teeth, but I probably that was probably the issue. So, and they're also expensive.
Yeah, they are.
But there is a way of.
But they're not single use.
No, they're not single use, but there is a way of flossing your teeth, isn't there? There's a technique to it. Oh yeah,
so you go back and forth, but you're not supposed to just hammer down past the contact. Like, you're actually supposed to floss like the dance, over and back past the contact of the teeth. And then when you get down to by the gum, you're doing a C shape around
Are you going
tooth.
up around the tooth, aren't you? Around the gum. Like, you're going in under the gum, around the tooth.
Yeah.
Yeah.
And then you're doing that C shape, but you do have to brush both sides. And a lot of people just go chuk, 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 chuk.
Yeah.
And it's not actually like doing the job. If anything, you're pushing the gum back and you're damaging the gum. So you have to go gently past the contact and then go up under the gum, C shape, and then pull it out to the side.
Okay.
Yeah.
Right. Okay.
But it is the cheaper way to go.
And is mouthwash necessary?
Mouthwash, I personally think, unless you have like a lot of cavities or gum disease, get the basics right and you're flying. You know, like, it's really like, you don't need to. The toothpaste though that I do say to use though, sorry, I just never answered that, is the is any sensitive based one, because with age you're going to get more sensitive teeth. So you may as well just, prevention's better than cure.
Okay. Yeah. Fair enough.
So just beat it to the punchline. And then if you're not rinsing, you're going to keep the toothpaste on your teeth. So previously people were always rinsing after brushing their teeth.
Yeah.
And it's like putting cream on your skin and jumping in the shower. So you're getting rid of all the goodness. So a lot of the time people rinse afterwards. So if you want to rinse, if you really are an avid rinser, I just say to use mouthwash like after work, after lunch, but absolutely nothing after brushing your teeth.
And how long for?
To rinse.
Yeah, how long would you have to wait to have a glass of water after you've brushed your teeth?
Like 30 minutes.
Okay. And and you're retaining all the goodness.
And you're retaining all the goodness. Yeah. So
that's interesting.
I know, that's something that like people are always delighted to tell me that they rinse when they come into the chair, and then I'm like, no,
stop rinsing.
I'm so sorry.
What about receding gums? Can we talk a little bit about that? Because there's people that they have receding gums, or there's people even that have got their gums
grafted.
Yes. What is that? Can you tell me about it?
So they take a chunk of, now I'm not a gum specialist. I just need to put that out there. But they take a chunk of gum from somewhere else. Sometimes you can get minier ones where they just lift up the gum from below and lift it up. So like that would be if you had like only a minor bit of recession. Also depends where it is. Like if it's in an aesthetic region, they have to do certain different procedures. But most of the time, the gum grafts are cutting a section of your palate off and transferring that bit of gum down. It's a lot of healing time.
Right, I can imagine.
Yeah, and very difficult to eat. I believe it's a 50% success rate. That's what when I was in college, when I checked it last, that it was a 50% success rate. So unless that's changed, which I don't think it has, because I see them fail a lot, it's like you'd really want to be getting it for like good reasons.
Okay.
Yeah. And I know people get upset about the recession and stuff, but you're better off just stopping it getting any worse and just keeping it clean.
So if you do have receding gums, it's just keep flossing well, learn how to do it properly, keep your teeth clean. But
no scrubbing.
No scrubbing. Can your teeth recede? Can your gums recede to the point that your root's showing, or the real top of the tooth is showing and you'll need to get it removed?
That would be like full blown gum disease.
Okay.
Yeah.
Okay. So is receding gums, is it gum disease or is it aging or both?
It's kind of, it's a thing in itself.
Okay.
Yeah. Because it has a different like etiology. So that the reasons that you get the gum recession are for just different reasons to gum disease. Granted, gum disease can be one of the reasons you get gum disease, but it can be scrubbing, it can be braces, different things compared to the gum disease. Like your main risk factors for gum disease are your smoking and your oral hygiene.
Okay.
So if you're really worried about your gum disease and either of those two things aren't in check, that's what I would be starting with if I had recession and gum disease.
Okay.
Yeah.
Okay.
I know. But they're the two main things. And then the next main thing is really genetics, which is just unfortunate for the gums. And it's really hard to tackle. Like,
so there is a genetic component to the mouth in general. And because someone asked that, is there a genetic component to people needing fillings more than others, or?
There you can definitely get like different dental disease, genetic diseases, if that makes sense.
Yeah.
But on the large part, like with regards to like my brother never gets fillings and I get fillings, that's hypothetical. Like that's what I always hear people saying. Like it is just a part where you're just made differently to me.
Okay.
Do you know that kind of way? And the tubes in your teeth, those tubes that I spoke of earlier with the bite, are just bigger.
Okay.
So your teeth are less compact. So the bugs can travel down faster and you get more fillings. But gum disease would be very genetic predispositioned.
Okay. It's funny when you're talking there about your brother and your sister. So I come from a family where there's myself and I have two brothers and I have one sister and they're all younger than me. So my sister needed orthodontic treatment when she was younger because her teeth were a little bit more like my dad's, there was a little bit of overcrowding. She got her teeth done. She's got beautiful teeth now. So I never needed it. I did get little braces on my two front teeth in my later years. As I've got older, I suppose they always kind of cross over very slightly, but as I got older, they crossed over even more. So I just went ahead and got it done. And they're great now. They're kind of straight. They've moved a little bit now. I think I need to go and get them retweaked. But it's just my two front bottom teeth. Anyway, to cut a long story short, I went to the dentist when I was in my early 20s. I went, to my dentist and she goes, open up there now. And she told me, she goes, oh, your wisdom teeth are all up. Were they painful? And I said, no, I didn't even feel them come up. She goes, you have the biggest mouth I've ever seen in my life. She goes, like my wisdom teeth, is that normal for your wisdom teeth?
Did you get a gold star for that?
I didn't know what to say when she told me I had the biggest mouth, but it's all making perfect sense now. But I'm not exactly quiet. But is that normal for your wisdom teeth to grow and you not feel a thing?
A good few people would get away with it.
Okay.
Yeah, a good few people would get away with it. A lot of us don't.
Okay.
Myself included.
And why do we have wisdom teeth when they cause such issues for people?
Well, like they are just an evolution thing. So now some people are getting none, some people get 2, some people get 3.
Oh, really?
Yeah, they are getting, the more evolved you are, the less you have. I have all of mine.
I have all of mine. So I'm clearly like the Stone Age. And what was the reason for them? So we could like chew off big hunks of meat?
Yeah, it's just, I guess, the like more carnivore diet you'd like, or the more meaty diet, you'd have more sets because that's where you do all your grinding and stuff. Like you're grinding down your.
So we are evolving as we evolve.
I don't know if we are.
It's mad, isn't it?
Yeah.
It's funny to think of that though, isn't it?
Yeah. And no, I love this fact, but it's probably such an irrelevant fact. But in Italy, they're called judgment teeth.
Okay.
And in Spain, they're called teeth of knowledge.
Okay.
And then ours are wisdom teeth.
Ours are wisdom teeth.
Oh, and then somewhere else, they're responsibility teeth.
Judgment teeth. That's
I know.
interesting. That's
I'm
interesting.
Like, it's harsh.
What was dental school like? What did you learn in dental school? Because I actually, I was going to do dentistry. It was either medicine, pharmacy or dentistry. And when I went to decide on my CAO, I didn't have physics. I was only doing chemistry for my leaving cert. So the fact that I didn't have physics, I needed to take up an extra science. So I couldn't do it. So I was like, okay, well, I'm not going to take up physics in 6th year in school anyway. So, but anyway, I did pharmacy, the end.
And look at you now.
Did you regret it? Do you regret doing pharmacy, Laura? Well, but tell me what college was like. What do you learn in college? Do you learn, do you aspire to be the best dentist you can be in? What's it like? Because it's tough. It's a tough course, isn't it?
It's a very, very tough course. And like, I don't just say that again because I did it, but like they do for the final 2 years have you working, like I think there was something like 32 hours nearly of clinics by the end of it, and then you're studying on top of it a week. And then like even before on our exam days, they would have clinics the morning of the exams. We had no exam periods like that, like people have. So it is a very tough course. They definitely, it's a very tough environment. Because again, even when I was there, I don't think like the whole thing had kind of come out yet where it's the patient-doctor relationship had become important yet.
Okay.
It was still it's old-fashioned in the teaching approach, in the sense of this, like, you're not, like, I treat, like, obviously I'm totally 110% professional, but I still would be like very like same level as my patients, because I think that that's important for people trusting you and telling you the truth and like working with you, and the anxiety and the whole thing. But they definitely teach you to be, they're trying to train you to think that you're better than the general public, which I think is a terrible way to be teaching. In that regard, they still do that? I don't know. I actually don't know. I think it's going to be from where I stood. I think it's going to be something that's going to take a very long time to change. Okay. Because it's a system. So to change that, I mean, the papers were only coming out in like 2013 really about that, like the beginning of it, of like how to treat patients nicer and like bedside manner, like that didn't come out before. So, and it only really became, it's funny that I actually became so aware of it, because then I went back to do an MSc in facial aesthetics, and one of my entire assignments had ended up being about like the consultation and bedside manner and that patient-doctor relationship, and not treating people like that, and not thinking that you're a pillar of the community and better than people. And
just because you know what you know, just
because you know what you know, like, and like no one's gonna trust. I don't understand how that trust level could come in, but they're still teaching it like that. I hope it changes, because you know what? I think it's a really great job for if people are ever thinking of doing it, but I think it's a really difficult place to get to. Like I honestly, I don't know if I could tell my future kids or whatever, like, to do dentistry, because I think it's so difficult to get there. So unless it changes. So it's difficult to get there, as in it's difficult to become qualified, but the job itself, is it enjoyable? The job itself is so enjoyable, but I love people. But do you like looking in people's mouths? I love it. But don't do it in like a nightclub. I will actually get grossed out. Okay. Like, I'll be like, I don't need to see your wisdom tooth back there. So you're not going to look at my mouth when we finish up, when we wrap up here. But isn't there a high level of, what people would have heard, or anecdotally in the past, that dentists die by suicide, or they are one of the professions that are least happy, or they abuse drugs, or they become alcoholics. Like a great bunch. But this seriously, no, I know. And now I am only speaking from a level of, I have heard this anecdotally. I've not read papers on it. But is there a dissatisfaction with the job once you're working at it? Because, as I said, you're looking in people's mouths all the time. Now, maybe you're coming from a cosmetic dentistry kind of
background where people might look after their teeth a little bit more, but it can't be very nice if you're looking in people's mouths that don't look after their teeth very well.
So I want to talk about that, but the looking in people's eyes, I just want to briefly say there is nothing more satisfying than cleaning teeth.
Great.
And taking off all that stuff. Now I wish it wasn't there in the first place, but oh my God, it's actually...
So where it would gross someone else out, you love it?
Oh yeah, but like, do you know what does kind of gross me out is like pussy things. I still haven't really got my head around that.
Okay.
But
I love pus.
Do you?
Yeah,
like
I love watching Dr.
Popper.
Pimple Popper. If anyone in the house has a spot, I'm first on it to squeeze it. I have the hands washed, the tissue by my side. I love nothing more than a pussy spot that jumps out at me.
I'm sorry. I have an abscess.
I'm sorry. Love it. I love
you
that.
have to cut them, and it's
I love that. But then I don't like blood as such. So
blood is a walk in the park for me.
Okay, so I don't like blood, but I love pus. Isn't that so weird?
That is actually weird.
Yeah.
Because it actually, we'd be a great team.
I think so. Yeah.
No, so funny that you say all that. Now, again, I haven't looked into the statistics. I personally don't believe I am a statistic, so I never would have looked into it for something like that. I actually did a maths and economics first. And my dad told me not to do dentistry. And the two reasons were like, I first of all just was like, oh, I'm not going to do it because he said it. But his reason was that I was too chatty and that I was going to find it very lonely. And the whole thing basically that you had said, he's a very happy man. But just in general, he was saying that like someone as outgoing as myself maybe wouldn't particularly like being in a room and the same people and a small team and all that. And then anyway, I did maths and economics. Maths is really hard. Way harder than school if anyone thinks they're up for it.
Oh, yes. It's like getting an A1 in Leaving Cert Maths is totally different to going to college and studying maths, isn't it?
They're worlds apart.
Yeah.
Anyway. Also, my brother did it, so I was like, oh, anything he can do, I can do better. I was definitely mistaken on that.
Okay.
So then I did, and then the economics, I'm not a great reader as it goes. So I kind of ended up navigating back towards dentistry. And it was kind of dentistry or medicine, I guess, is what was left when you remove any subject with essays and maths. And then medicine, what I didn't want to do, like on-call hours, and I wanted to be my own boss. So then that left me with one. Okay. So I did go into that now. Again, as I said, there's no doubt about it. I found dental school very difficult. There were definitely moments where I was on the verge of giving up. Not because I didn't like it, but because again, when I got to the real world, I was so glad that I stuck with it. But then when I got to the real world, it's really the driving force of why I went onto social media was because I was seeing, well, first of all, the information wasn't out there in the HSE. There's actually a very good story about that. But that, and then I felt like all of my friends as well were in these like big work environments and making so many new friends, going to like basically a new college version. But everything's what you make it. Do you know, that kind of way? So when I felt like I was being like not making as many connections as everyone else, and that was something that I wanted to be able to do, then I went out and I did that. Do you know? So I do think, and that goes for every job. Like I wouldn't...
Absolutely. And I would say that even coming from the pharmacy perspective, sure, why did I start doing Instagram was because I wanted to, a bit like yourself, just kind of get the information out there. And also kind of, well, it wasn't as social when I started a few years ago. It really is now. Like I've met so many people. Sure, you messaged me and said, I want to come on and talk about dentistry. I was like, great. But it is funny how you can make those connections. I know so many more people now, but it's about, it is what you make it.
Yeah.
Whatever
so that's
career
why,
path you take.
I mean, you could look at the statistics of dentistry, but like, and say that like people are suicidal or alcoholics or whatever. But I do think a lot of people are doing it for the wrong reasons. And I know this is going to be a huge blanket statement, but I think a lot of them do it because they didn't get medicine. And I mean, that's not a reason to do it.
That's going on my reel. That comment that you just made is going on the hook reel.
You're going to take all my boldest statements and hang me.
You're going to be like, take that down.
No, but it's true. It is true. And actually, like,
but is it not the same? What do you mean didn't get medicine? Is it not the same? Roughly the same?
HPAT.
Oh, the HPAT. Okay.
HPAT. And I think at the time,
but it's such a different
They're
practice. They couldn't be any more different.
Different. Yeah. They're completely different. But even like in my year, I think there's 7 that have gone back to do medicine.
Okay.
Do you know this? So it's a bold statement, but it's true.
I actually know there's a dentist down the road from me. He did medicine and then did dentistry.
Yeah.
So he pivoted the other way.
Or he was doing max fax with the maxillofacial surgeon. Did he do that in the end?
No,
that's a very cool job.
Just dentistry.
Oh, he just went pure dentistry.
Yeah. Gosh, not mad.
He's one of a kind.
Yeah, but there's a good few. So what's max fax?
Max fax is anyone that deals with like, they actually just study medicine and dentistry, and they deal with the bones of the face. So like if someone has oral cancer and they need it resected, so they actually like a very cool job. They cut like sections. Obviously not if you're the patient, but they rehabilitate.
You have to put that in there just in case we're like, oh my God, I just love it when someone has, cancer so I can do my job. Yeah, obviously. But
I feel like they really make
job.
Drastic improvements, because not only are they getting rid of cancer, but they're involved in restructuring the face so that you can have a livelihood afterwards and that you aren't psychologically scarred afterwards. Like, I think they're unbelievable.
And would they work for people that have had traumatic car accidents, say, and facial disfigurement as a result?
There was, yeah, when I did, so I actually did an elective on it. There was a hot minute where I was like, I'm going to do it.
You still be studying?
Which I was sick, as I was like, no, like once I graduated from dentistry, I was like, tapping out. This, and a girl actually, she was in a car and she didn't have her seatbelt on in the back car, in the back seat, which still too many people don't wear their seatbelt in the back seat. But anyway, she didn't wear it in the back seat, hit her face off the headrest and inverted her nose.
Okay.
And her nose went in to her face. And she had to get it all reconstructed back up, and they were transferring like cartilage, so like bony material that's in your nose, like her ear, to build her nose back. And like they did that, and she was only like 18.
Wow.
Yeah.
It is amazing what can be done, isn't it? It's
incredible. Like, and like they graft from the hip. So they take sections of like the hip bones and skin from the arm to like make the jaw again. So not funny, but funnily enough, if you have someone that's had that oral cancer, often they'll have to get like their hairs plucked from their mouth after, because it's arm skin.
Wow.
Yeah.
That now every day is school day.
Objectively.
That is mad.
Isn't it? Yeah. No, so they have really cool stuff up there. Like,
okay.
Yeah.
But so that's surgical training as well as dentistry, is it, or what?
Yeah. No, that's medicine, surgical training, dentistry, the whole.
You're not qualified till you're 55, I'd say, in that.
Yeah. No, like you're one of the reasons I actually decided like that it was an absolute no-go. The lady who was one of the registers at the time, she was like, it's this or everything else. She was like, marriage, kids, everything else or this.
Oh, okay.
And I was like, I was put on this planet to like have fun and help, not just.
Yeah. Okay.
It's just different people. I mean, if you're passionate enough about it, you could definitely do it. But I just like my life as well.
Okay.
Yeah.
I have a couple of other quick questions to ask you before we get on to my 2 burning questions that I ask at the end. Sorry, just on the teeth whitening and pregnancy and breastfeeding, can people take them?
No.
No?
No.
Okay.
No.
So any of them, they can't use the whitening strips from the OTC, or?
Just stay away from them. No one will ever say to do it, because they just don't want to be responsible.
With breastfeeding?
No.
Really?
Yeah.
Okay.
No.
Okay.
And again, it's just no one's going to put their
well, I think that the breastfeeding network, God, you have to correct me if I'm wrong now.
Because I have looked it up like a gazillion times to check if it's changing, and they always say no.
Okay.
But again, I think it's just.
But it's just a safety. It's just because people don't want to be sued, just in case. But there is no reason why people couldn't, as far as I can see, because I'm big into the whole breastfeeding and what people can do, as opposed to what they can't.
Yeah.
And I think the breastfeeding network say that there's no reason why people can't. But I will look that up before I do the outro for this, and make sure that I've got that right before I do.
That's right.
Yeah, and then there was another thing. Oh yes, what age should people take their kids at for their first dental appointment? You know,
so it's supposed to be the minute you have a tooth, technically.
Really? Like a little baby tooth?
Little baby tooth.
Oh.
And again, that's just because they come in, they sit on the chair, you count their tooth, you go. Like, you're not really going to do anything. But it's the getting them in the system, not being scared of the environment. If they pop in every so often, they're never going to see it as a big deal. That's all that's really about. And then when they get to like about 1.5, you're making sure they all have the right teeth at the right times. Like, then you are checking for like the teeth coming at the right times to make sure there isn't anything wrong. But like in terms of the first tooth, it is just about the visit.
But what can you do at that stage anyway when they're 1 and 2?
It's just monitoring.
Oh, okay.
It's all just a monitoring thing.
Okay.
But yeah. Okay. But then, and like the other thing is then again, and that was actually the story I was meant to say, and it kind of all ties into the HSE funding, and they coming to the dentist that early is really about being taught how to brush your teeth, diet, etc., etc. Just FYI, no jellies, no toffees, no Mentos for anyone. Just need to put that out there while I'm thinking of it. It's about being told about the diet and the brushing, and loads of people aren't taught that at all. And like then there was this situation that just stuck in my head, and I honestly, when that happened, that was the absolute breaker for going on, doing the Instagram, trying to get people out there, trying to network, try to get people more involved in their hygiene and really cut to the basics. Because there was a 4-year-old who had come into me and he had 10 teeth with decay. And at that point, you only have 20. And he had 10 with decay. And the other 10 had been taken out.
What?
4 months previous. And he had been put under general anaesthetic to get them out because you can't possibly take that many teeth out on a child. And you're putting them under the risk of general anaesthetic. Or maybe it was May to September. His general anaesthetic was in May and this was September. And he needed the other 10 out.
And is that so that the other teeth coming down wouldn't rot?
So no, because now there's nothing in place. So actually very important topic. People always ask, just take out the baby tooth. It's just a baby tooth.
There's a reason for it.
Stab me in the heart. The baby tooth holds the position for the adult tooth. Baby teeth will reduce the risk of needing braces in the long run because they hold the space for the adult tooth. Otherwise, it all falls in. Okay. And if a baby tooth has infection, and I was asked this the other day, which I think is important, that their baby tooth was given an option of root canal. And yes, that is a thing. It sounds mental, but it is a thing. But it's an option because you want to try save the space rather than put a metal hoop in to try hold the space, or give them a little denture to hold the space, because that would be risky with a 4-year-old or whatever. But if the tooth has an infection at the root of it, which is why root canal is given sometimes, that acid-base balance, everyone's back to their junior cert science, is going to interfere with the development of the next tooth, and you're going to get softer teeth. Okay. Inverted quotes. Okay. In case I knew. Softer teeth is not really a thing, and I really don't like people using it because it seems to be an excuse a lot of the time. But that would be a prime example. It would come up as a bad tooth. Okay, so what does softer teeth mean? More porous? More porous. Okay. They just can't develop right, and they just don't have as much minerals in them, and they crumble, kind of. Yeah. But that 4-year-old needed the other 10 teeth out, and I went through the diet with the mum, and this mum meant so well, but I was in an area that wouldn't have had as much exposure to brushing your teeth and the general basic knowledge that some people have. And anyway, she really, really meant so well, and she nearly started crying. Oh. And I couldn't understand it. So I started going through the diet. I was like, this person isn't obviously letting their kid just have go rogue on sweets. I was like, there must be something way bigger, because she's honestly in bits. And I went through the diet and she's like, no to everything. And then she goes, except for the 7-Up every day. And I was like, what? I could not understand. And I was like, oh, why is he having 7-Up every day? And she was like, oh, because after the general anesthetic, he felt faint. They gave him 7-Up and I wanted to make sure he would never faint.
Oh.
So she'd been giving him the 7-Up every day since.
Okay, and that rotted his teeth.
And that rotted the rest of his teeth. And now he was 4 with no teeth. And like, I was like, how?
And then obviously then they're not holding the place for the others.
Not holding the place.
So we need more education though as well. And
for him.
And like we need more education for people, for all kids on how to look after the teeth, but particularly in those areas that you're talking about, the socially deprived areas maybe, where people aren't being taught. You know, but that isn't happening, is it? No,
like, it's just not happening. Like that is where the funding is getting slashed and it makes no sense. But even like you're saying, like 100% agree with the socially deprived areas. But like, for example, I don't know, do any of your kids play sport? Apparently they give out jellies left, right and centre.
I hate it.
And sports drinks and this and that. And it'll be because someone's dad works somewhere or someone's mum works somewhere and they're giving them for free. Or
you go to the mini All-Irelands and the treat at the end of every match is jellies and stuff like that. Or it's something that I don't like at all. But I would have been very, very strict on their diet. Up until recently. They're a little bit older now, but I would have been very, very strict on sweeties and things like that. I hate, I'd never have them in the house, but for some reason they managed to get them somewhere. Those bloody Haribos or whatever they are.
I know. And also then if you totally deprive them, then it's like they go mad when they finally get them. There is like that balance. And like I always say, like I have a sweet tooth. I absolutely do not ban sweets from everyone. That is not the solution to the situation in general for people. Like, as I said, no jellies, toffees, Mentos, hard sweets, because they get stuck into the grooves and they take way longer to get so every time you have any sweet, your teeth rot for an hour afterwards.
Okay.
But if they're stuck in the grooves, they rot until the hour only starts after the last bit's dissolved. So that's why if you're going to have 2 biscuits, have them together.
Yeah.
Don't space them out. And like,
should you brush your teeth after every meal?
No, wait the 30 minutes for sugars, right? But no, morning and evening's enough. But the things, again, these were all things that I would have always been saying to the kids, is like to have your treat after dinner, because your treat will stick to the residue of your dinner and kind of get brushed away. Have a glass of water with your treats. Don't have it as your 4 o'clock snack, your sweets. Really, honestly, this one goes so long, is give your child water. Just give your child plain water. They are not going to like collapse of dehydration.
Yeah.
They will take the water. I mean, you're going to have arguments potentially, but eventually
so my waddy, no. And even the sugar-free stuff.
Even the sugar-free stuff, because that causes more acid reflux, which damages the teeth. And like,
but also gives them a taste for sugar, doesn't it?
Gives them the taste for sugar as well. Yeah, I was going to say. And just give them the plain water. And because the if you sip on those drinks, it's that hour only starts after the last sip, so they're constantly rotting. And like, if you don't be drinking your My Waddies and your fizzy drinks, fizzy water is included there, I am sorry. But if you don't include all of those, well, then you get to have a treat.
Okay.
But if you're having your My Waddy all day, your Coke for dinner, your chocolate bar at 4 o'clock, your jellies after dinner, your teeth are rotting all day. So it's about being just aware, and your cereals, like only Weetabix and porridge are the sugar-free ones. Special K, all of them sugary. So if you have
cornflakes, Rice Krispies, all of them. Yeah.
All of them. So if you add all of those things together, your teeth are rotting all day.
Okay.
But I don't mind you having chocolate in the evening or chocolate on the weekends.
30 minutes after you've eaten. Don't brush immediately after you've eaten.
Yeah. Okay. But I mean, really, if you brush them twice properly, don't rinse. That's enough. You're just watching the diet for the other things. Trying to stick to the things that slide better for treats. So your biscuits, your crisps, your chocolate, popcorn, those are the better things to go for.
Okay.
Yeah.
Something come up there and I wanted to ask you and I've forgotten what it was. It was to do with the junk food or something, was it? I can't even remember, but it seemed really important at the time. I was like, it was, but I didn't want to stop you halfway.
Oh, no.
Anyway, do you know, we'll get on to our 2 questions that I ask every podcast guest. And I might remember them while you're talking. And if I don't, we'll just have to get you gone. Oh no, I know what it was.
Okay.
Sparkling water. I saw your Instagram the other day. My mind was blown.
I'm so sorry.
So
feel like
I
such a
didn't
bear
know
family.
that. And I love the whole pH scale. Jesus, it's my bread and butter. But go on and enlighten us all about how bad sparkling water is. Because I was considering getting a soda stream just so I could have sparkling water on tap in my house. But now Bronagh's put me off. Listen to this, guys. Bit of trivia.
So the pH acid balance, Laura's expertise field, is neutral is 7, and the teeth start to be damaged at 5.5. Sparkling water is 4, Coke is 2. So at any time it drops below that 5.5, you're getting damage for that hour afterwards. And that doesn't matter how low it goes. That's flat.
So even though you're drinking the water and you've drunk the water and it's gone down your gullet,
An hour later,
it's still okay. So if you're sipping sparkling water all day, you're ruining your teeth.
You're ruining your teeth, yeah. And it's just because the bubbles are carbonic acid. It is an acid attack. Yeah. So don't get the soda stream.
I'm not going to now, but my 14-year-old's going to be bitterly disappointed. Anyway. Yeah, I just wanted to get that out there. I think I've asked you most of the questions that come in.
Did I pass?
You did. You did a great job. Initially, I thought you were like, you felt like as if you were under fire, but you did a great job. I've actually
Thank you.
really learned an awful lot, and I know loads of people are going to get a lot out of it. Can I ask you what you think the meaning of life is, and what advice would you give to young people today?
Okay. God, I hope I don't get them mixed up because I've been thinking about them loads now. So I think the meaning of life one. The meaning of life is to be yourself. And I know that's so basic, but I have always been on the outer skirts of nearly everything that I do. I've always been the outlier in school, in everything. I don't like fitting to a mold. And definitely at times it was so challenging. And there were times where I wish that, I mean, I never would have changed, but there were times where I wish that I could have just been like more not different. And looking back on it, I'm like, it actually made me who I was. I would not change it for the world. And I just really hope that if anyone's ever struggling for being different, that they just stick to their guns and stay themselves.
That's lovely. It is. Well, coming from someone who's also a little bit different. I can empathise with you, Bronagh. Yeah. So what's the meaning of life? Is that the meaning of life, or was that the advice to young people?
That was my advice.
That was your advice to young people. Okay, so what's the meaning of life?
And then the meaning of life, I think, is to have fun. But that is it's to have fun with what you do. It is and it ties back to us going on socials to make the job we want. And it's like to just make sure that whatever you're doing it for the right reasons, that you're having fun doing it, and that's pretty much it. You're not put here on this planet to be like going through a slog. There's so much stuff out there to have fun with, and it's just about finding it and not settling into a mold that you're unhappy with, and just get that fun.
Oh, I love it. Bronagh, thank you so much. And Bronagh, where can people find you?
So my Instagram handle is Bronagh Keane, and that's pretty much where you can find me. I have
Irish Tooth Fairy.
No, that's not actually the handle. That's just my trademark.
Okay.
But my website is Ireland's Tooth Fairy.
Okay.
But yeah, no, it's just because I felt like it'd be easier to find me if it was my name. So yeah, Bronagh Keane, BRONAGHKEAN.
Okay, lovely. And where do you work?
And I work at Rock Road Dental in Booterstown in Dublin. Yeah.
Okay.
Thanks for having me.
Thank you so much.